Disc bulges can be extremely painful and they can be annoying. You're always trying to find out what you can do to take that pain away. Do I stretch it? Do I exercise it? Do I crack it? Let's give you some insight. If you haven't watched my video yet on the 3 stages of disc bulges, that might be worthwhile to check that out first, because there are different degrees, different stages, and some of them you just want to cast them, meaning you don't want to move too much through your spine. You need 4 to 6 weeks or so of just being very gentle with moving through the spine. Some of them, there are certain stretches that can be okay. You can watch our video on stretches for disc bulges. What I talked about in that video, the more chronic stages, what happens with that disc, say this is a bone and this is a bone, the vertebra, they start to come closer together, and when that happens, they can shift. And when that happens, your repetitive movements through your spine, which are your daily activities, anything you do throughout the day, they are going to aggravate that disc bulge. They're going to aggravate your spine, and so you're going to want to stabilize that. So in this video, I'm going to talk about 3. There are many exercises, but the 3 basic exercises, the starting points, what I call the safe exercises, usually these are the safest exercises. In some acute cases, if these are aggravating, don't do them. Watch some of my other videos on how you heal that disc bulge. When the acute pain is gone, when the inflammation goes down, then you can slowly start to strengthen. The first exercise that we talk about is a bird dog. And in this bird dog exercise, it works really well because you're strengthening the front, the sides, and the back. You have to stabilize through your front stomach muscles. If you do it correctly, you bring one leg behind you. You could even bring the opposite arm in front of you. And as you do this exercise, your abs are engaged, your low back is engaged. So this can be a great exercise. This video is not meant to be a video that you follow along with, just to give you some information. Another exercise that is extremely beneficial is the side plank. This is, again, just a basic exercise that can be helpful. A lot of people want to work the front stomach muscles. The front stomach muscles right here, you go from here to here. There's 2 muscles from right there, from right where my thumbs are. The side abdominal muscles go from here to here. It's a much larger surface area of those side stomach muscles. They wrap all the way around, and they really help protect that low back. So these side planks are a great way to engage that muscle and to get you a little bit more body awareness on how to strengthen your core. And then some pelvis stabilizing muscles could be things like bridges, or they call these glute bridges, glute max bridges. But you're going to work the butt muscles or the glute muscles when you do this. And especially if you do it with a single leg. You lift one leg up in the air, that forces you to use that glute even more, and you're going to start to use some of the back muscles as you do this as well. So there are many exercises that you can do for core stability. These are sometimes the 3 that are that a lot of physicians will start with, but from here you definitely want to progress. And there are a lot of other things to do, but this is just some good insight into 3 basic exercises to begin with for core stability, especially, again, if you're in those later stages of a disc bulge.